Hello, everyone. Welcome back. I hope everybody had a fantastic holiday of the time in December. Hopefully you spent it with family and were safe. I am Elizabeth. I'm one of the travel nurses here at CNY Fertility. And I am just here each week for about 30 to 45 minutes just to chat about different parts of this process in terms of being a travel patient here at CNY Fertility. And tonight I wanted to talk about something that I think gets highly overlooked throughout the course of this process. So, you have your consult, you talk to the doctor, and all of a sudden we start out on a complete whirlwind of kind of process-oriented, task-oriented things, such as medications and calendars and your cycle days, and all of these things start to become kind of forefront in our mind. And sometimes we forget why we're doing this. And we forget mainly to take care of ourselves in the process. And so tonight's topic is just talking about self-care during the fertility process. Again, I really do believe that this part is probably the most often left out, but oftentimes is the most important part of the process. And so I will, as usual, I will answer questions later on down the line. So definitely keep those coming. I'll certainly do what I can after the broadcast is over to answer your questions from the thread. I know I'm not able to get to everybody, so I'll do my best in terms of getting to those. But let's dive right in to talk about self-care during the fertility process and some tangible things that you can do to increase your overall outcome and your overall success. And so, a diagnosis of infertility is something that none of us expects. This is something that none of us thinks about when we are, young and talking about having a family. And so oftentimes that infertility diagnosis is met with a lot of grief. Losing out on those ideals that you had, maybe for having a family. Maybe it's not going to happen exactly like you hoped or planned. A lot of stress and anxiety come with that diagnosis. And then a lot of loneliness comes with the diagnosis of infertility. More and more as time goes on, we are becoming as women more empowered to talk about infertility, to talk about what that journey entails. But even as little as a few years ago, infertility and the discussion around it wasn't something that was as mainstream. And so women still often feel like they can't talk about it with their friends or their family. And so loneliness is a big part of the process that, we need to kind of be aware of up front so that we can deal with it down the line. So stress, anxiety, loneliness, and those are the three primary sort of, we could call negative emotions or feelings that come with this process. And I've talked about it before, but stress is 100% the enemy of this process, potentially tied with sugar, but we'll get into that a little bit later. But stress is really the enemy of a lot of things, but of this process is definitely one of them. Stress, whether that be emotional stress, physical stress, financial stress, relationship stress, all of those different stressors initiate processes in our body that ultimately end with inflammation. And you've probably heard me talk about that on more than one occasion, but stress and being in a stressed response all of the time creates a situation in our bodies where we are dumping out inflammatory markers and things to combat that stress. And so as much as we can, part of the process is just being aware of that stress and acknowledging that stress and saying, you know what? It's okay that I have this stress. This journey is going to be difficult. And so I'm going to take it head on and I'm going to establish some things that can help during the process. So a couple of tips, and these are tips that from my own journey, I spoke with several of our different nurses here at CNY Fertility that have been through the process, and a couple of patients over the past week or so, just to try to make sure you understand this isn't just me speaking, that this is a lot of collective experience and suggestions that are tried and true in terms of helping to combat some of this process. One thing that's really helpful is right in the beginning, get organized. If organization is your strong suit, great. If it's not, now's a great time to invest some time in being organized. And that can consist of a couple different things. One is I find that the more you can have laid out how the process is going to work, and the less surprises you have, the less stress while you're amongst the process, if you will. And so one great thing you can do is you can take a look at IVF journals that oftentimes have a calendar component to them, and they are geared towards fertility. So there's places to include medications and contact information and things like that. There are many out there. One of my favorites is by a company called Piper Patch, and they offer an infertility journal. It was founded by an infertility warrior, and it's a great, it actually combines a lot of the things that we're going to talk about tonight: mindfulness, gratefulness, scheduling, all of those things. It kind of combines into one journal or book that allows you to kind of get everything organized right in front of you. So I love that. And I also love organizing in terms of your medications, using an app on your phone, or whatever you want to use, but organizing your medications so that you know exactly what you're taking, when you're taking it. And these apps are, most of them, you can find them for free on the App Store on your specific phone. One that I really like is called Medisafe, Medisafe. Medisafe. That is not, to my knowledge, that is not fertility specific, but you're able to enter the medications, the time that they're due, and it will alert you, will send alerts to your phone, set alarms, things like that. Nothing worse than losing track of time, missing an injection, missing a trigger shot, something like that can really make or break the cycle. And so an app to sort of track your medications when they're due and those sorts of things can be really helpful. And if you are to get an infertility journal or something of that nature, it's a great time in the beginning, before you ever start the cycle, just to kind of go through each of your medications in your CNY portal, and make sure that you, in fact, do have all of those medications. Again, nothing worse than getting to trigger and realizing you're missing a medication. And so that can be a great way to kind of get everything organized, make sure you don't miss anything. So getting organized is the big first step. And part of that organization is making sure that you've kind of cleared your schedule. And I know that's a lot, it's much easier said than done for many people. But looking forward to that time frame in which you plan to, which app again? It's the one that I recommended, Crystal, is called Medisafe, Medisafe. But there are plenty out there. You can search your app store on your phone for different. There's another great example. Hi, Carla. Yeah, there's a lot of options out there in terms of medication trackers, but just something to keep you on schedule and make sure that you are taking the right doses at the right times and things like that. So that can be really helpful. So back to preparing your own schedule. Thank you, Crystal. Back to your own schedule, looking forward at that period of time in which you plan to do your cycle, and sort of trying to move any unessential things out of the way. And, not too many of us are knowingly engaging in wasteful, meetings and things like that. But where you can, try to prevent having a big meeting or a big trip or a big test or any number of other sort of big life things as best you can to sort of carve out that time and really make it the time that you're going to focus on the treatment cycle. Again, I know this is easier said than done, and not everybody has that ability, but where you can, try to look ahead a couple weeks and see if there's anything that you can adjust just to help avoid hi, Ronnie. Thank you so much. Just to avoid, having those extra conflicts during the cycle that can add that stress. There are going to be stressors that we won't be able to avoid, but there are things that we can avoid. And where possible, by sort of pushing those off to the edge, we allow for ourselves to have the time and the energy to devote to the process. So clearing your schedule where you can and avoiding any big stressors during that process is a really big step in terms of just making sure that the cycle is going to go as smoothly as possible. Another topic or another idea in terms of self-care during the process is something that I'm learning more about personally, but it's the idea of mindfulness and deep breathing. Deep breathing, a concerted effort to practice deep breathing can actually help to rewire our nervous system and can help our what's called our autonomic nervous system, which is the part of our nervous system that kind of works on its own. Our heartbeat, our breathing can kind of help regulate them to lower our stress levels. And so here again, I'm throwing out lots of tools, but one of the breathing techniques that I really like is called 4-7-8 breathing. Essentially, you breathe in for 4, you hold it for 7, and you exhale for 8. And as I'm practicing mindfulness and deep breathing, I'm finding that it's a lot easier said than done. It doesn't come naturally. You'll find yourself distracted, thinking of other things. It takes time. It takes time to get good at, just like anything. It takes a lot of time to get good at, but it has so many positive benefits. It's free. You can do it anywhere, and it really has clinical benefits that can help lower your overall stress level. And if you find that maybe the deep breathing that I just recommended, 4-7-8, maybe that one doesn't work well for you. Again, if you look in on your phone, we use our phone for everything. But if you look on your phone for deep breathing exercises or deep breathing apps, there are plenty. Cycle through them, find one that you like, and you can even toy around with, the specifics of, the length of time you inhale versus exhale and those things until you find something that's comfortable. And then deliberately practicing that 10 to 15 minutes a day, every single day, can lower those stress levels and just help you improve your overall emotional state and your overall physical state as well. Like I said, it does help to synchronize your nervous system, which can really help in terms of a positive outcome. If breathing techniques maybe specifically aren't your thing, other forms of mindfulness, meditation, prayer go a very long way. Ronnie, I'm going to just post this here so everyone can see. She's using looks like a song type app on her phone for meditation right before she goes to bed, and that seems to help her sleep too. And we're going to talk about sleep here in a minute, but using the resources you have to help embrace these things will make such a huge difference in other areas of your life. Just like she said, for sleep, there's other options, and several people are posting. So post in the comments your favorite, if you have favorite apps for tracking medications, for tracking appointments, for sleep, for relaxation, mindfulness, breathing, what have you. Post them in the comments. Let's help everybody find something that they're comfortable with, so that we can all improve as we move forward. And then we did talk about prayer and meditation, and those are other things to take a look at and see if you can find something that works for you. In that same sort of wheelhouse, acupuncture, massage, traditional Chinese medicine, those are all areas that I highly recommend. Acupuncture for sure. I'm not entirely sure. I think I've mentioned this before. There are acupuncture locations everywhere. You can find acupuncture clinics pretty much everywhere. Some places have what's called community acupuncture centers, which offer a little bit of a lower cost. Again, I think I've mentioned this before, but with the different social distancing requirements and things like that, I'm not sure to what end those types of places are operating, but definitely take a look at community acupuncture centers in your area, and see if that might be an option for you. you, but that can lower, I know acupuncture cost is a prohibitive factor for, many of our clients. Not practical necessarily to spend $90 a week on acupuncture, but there are a lot of different options out there. So definitely look around and see, can you get in for acupuncture once a week? And that only, we oftentimes think about doing acupuncture right before and right after your transfer, just because we have those known clinical benefits of acupuncture on transfer. But the truth is that acupuncture and traditional Chinese medicine can help in really every area of our life. But by reducing stress, again, stress is very much the enemy of this process. And so by reducing stress from the very beginning and getting our bodies in a very calm state of mind can help with our outcome in egg retrieval and beyond. So take a look at your options for acupuncture, traditional Chinese medicine, massage. A couple of sort of things that I like to do that you may or may not find helpful, but simple things like creating a playlist on your phone of songs that are uplifting, ones that you can listen to on your way to and from monitoring visits, on your way to and from New York or Colorado or Atlanta, wherever you're coming to have your treatment done. Having an uplifting playlist to not only play during those times, but also during times where you get really stressed or you get really frustrated, or maybe you get news that you weren't expecting, by reverting to something that brings you happiness and joy, puts a smile on your face, can help to divert some of those negative feelings that creep in. And so finding a playlist, and even more than one playlist, maybe one for, when you're feeling frustrated, and maybe another when, you just need a little inspiration. But that can definitely be a huge help. So think about it, create a playlist, and lean on it when those times call for it. And a big topic, we mentioned it earlier, is sleep. And having a sleep routine and following good sleep hygiene habits can or break your cycle. They can make a huge difference in terms of your outcome. And so I highly recommend, again, other people are talking about different apps that they love. If you have a sleep app that you love, definitely share that with in the comments. But taking a look at a sleep app and tracking, when are you going to bed? Are you going to bed at a consistent time each night? Are you following those sleep hygiene techniques kind of that I mentioned? Things like, I know it's difficult, but turning your phone off and not looking at a screen within a certain time frame before bed, meditating, doing things like that. Sleep hygiene really can be a big indicator of our overall health. And good, healthy sleep will be helpful towards the process itself in terms of the simulation. Okay. Another thing that's a little bit maybe not necessarily taboo, but something that one of our fellow nurses shared with me that I thought was really important to share, and that is don't stop being intimate with your partner for reasons other than baby making. Okay, so oftentimes this process becomes just that, so process oriented, that we forget that this is our life partner. We're in a relationship. We need to support each other. We need to be intimate. And those things are important in and outside the process, but helping our partner understand that we are in this together, and keeping our relationship fun and light, even in stressful times, but not making sure we don't just relegate intimacy to our trying to conceive journey, because there are obviously many benefits to a healthy intimate relationship outside of our trying to conceive journey, and forgetting about that can definitely put a strain on our relationships. So definitely don't stop being intimate for reasons other than baby making, although very important. That's why you're here. But just keep in mind that our relationships are going to be here well beyond this process, and we do need to do what we can to sort of foster those now. And speaking of relationships, creating a support system that you have in place ahead of time of people that you can call on for different reasons. And so maybe you have a good friend who's great at talking you off the ledge. Call him or her and let them know, what you're embarking on. They probably already know, but ask them, will you talk me off the ledge when I'm getting stressed out or when I'm getting nervous or any number of reasons? Can you be my person? I can call you and you'll talk me off the ledge. sounds potentially a little silly, but there really are a lot of benefits to making sure that we have people in our lives that can help support us in times where we maybe can't support ourselves as well as we would like. And so having those people that hold us up, that support us, are critically important. And whether or not you have somebody in your life currently that could be that person for you or not, another huge self-care topic that I'm going to mention is the potential of looking at having a fertility therapist or a therapist in your corner. That's another topic that can sometimes be difficult to discuss, but there are specific professionals out there who do specifically fertility type counseling. And like I mentioned in the beginning, stress, anxiety, loneliness, depression, these are all very normal aspects of this process. And I find we don't necessarily always give ourselves the permission we need to have the emotional responses that the situation might warrant. And so I highly recommend looking into a fertility coach or a fertility therapist to have that sounding board, because no part of this process is going to be easy. There are going to be parts that are going to be easier than others, but no part of this process is going to be easy. And so having that support system, whether that be through friends, family, and or a fertility coach or fertility therapist, can really make a huge difference in how well you respond, not just physically to the treatment, but also emotionally to the overall process. I know I've mentioned her before, but we have an amazing support professional here at CNY Fertility. Her name is Christine Goldman. You can reach her through the patient portal, but she offers fertility support sessions, I believe, over Zoom, over the phone, different options. So if you're looking for, and she may even have some suggestions of local professionals if you're wanting something more face-to-face, but definitely utilize those resources to make sure that you are being supported. You should talk about this process. It's not easy, and you do need support. And so utilizing those resources is going to make a big difference in terms of your outcome. All right. Next, we talked about sleep. One thing we haven't talked about, but that is a huge part of self-care during the process, is a nutritious diet. Obviously, we here at CNY Fertility highly recommend Dr. Kiltz's keto. If you are unfamiliar with that, when we're done here, please go over to cnyfertility.com and take a look at some of the resources that we have on our website for Dr. Kiltz's keto. It's a very specific form of keto that is geared specifically towards conception and reducing inflammation in our bodies and increasing our overall ovarian function and our hormonal function. I will let her know, Crystal. So nutritious diet, ketogenic if you can. We understand it's not for everybody. Lowering or eliminating sugar is going to be a huge aspect of the process. So if you're not able, or you're perhaps not interested in keto for whatever reason, definitely look into very low carb, low sugar options, more whole foods and natural foods, and things that feed your body. If we're filling our body full of junk, and expecting it to do that, basically its most important thing that we're asking it to do, the expectation of expecting it to give us a great result if we're filling our bodies with junk doesn't necessarily follow. And so looking into small ways, I understand very much this process is, again, something that none of us ever expected to take part in. We necessarily, when we found out we had to do it, we want to just get it over with and get it done with. But some parts of this process do involve properly preparing and making sure that we do have everything in line. There are oftentimes situations where women will try a couple cycles, are unsuccessful. They take a month or two to get things in order, like we've mentioned here, their sleep, their stress, their nutrition. And these things they come back for a treatment cycle and they are successful. And so not enough can be said about making sure that we feed our bodies and our minds with the proper fuel and nutrition that they need to do the job that we're asking them to do. And so again, if you're unfamiliar with Dr. Kiltz's keto, definitely take a look over at drkiltz.com or cnyfertility.com and take a look at some of the recommendations that he has for following a ketogenic diet. And so the last big sort of tip that I have for taking care of yourself during this process is to laugh. I know it's definitely another one that's easier said than done, but the more we can laugh, the more we can release those endorphins and help to improve our overall stress levels and our anxiety levels. And so whether that be watching a compilation of epic fail videos on your favorite website, or, looking at funny memes, maybe look at take up a sitcom series on TV, whatever the case may be, but definitely find ways to laugh and to smile. And part of that, we talked about mindfulness earlier. That can be something like taking a walk outside and just taking time to notice the trees and the birds and the clouds. And there can be a little element of mindfulness involved in laughing too, allowing ourselves to find the irony or the humor in different situations that probably aren't that funny, but it's one of those sayings: if you don't laugh, you'll cry, and that can very well be true. And speaking of that, definitely give yourself permission to cry too, where needed, and that can be where a support person or a fertility therapist, fertility coach can come in really handy, because that can be your person that you can let it all out to, because there will be a time during this process that you're going to want to cry, other times you're going to want to laugh, and you need to feel supported in all of those things. And so, like I said, whether it be a sitcom that you're going to watch, or a online blog that talks about the difficulties of everyday life, these things can be really important in helping to make sure that we do release those endorphins, and we're laughing, and we're getting things off of our chest. So that's pretty much everything I had in terms of ideas for taking care of yourself and taking care of your relationships during this process. I would be happy to answer any questions that folks have at this point. I'm going to take a question from Selena, who is asking, what can I expect from a consultation appointment? Do I need to prepare certain things beforehand? Selena, thanks for that question. It's a great question. And from a consultation, what you can expect is that you will have a time set aside with one of our providers, either in person. If you are local, we are doing mostly remote consultations right now, just to keep social distancing. But you'll have an opportunity to talk with the provider about your journey thus far up to this point, what you have and haven't done, what testing you've done, and then what the overall treatment plan is going to be. And so one really helpful thing that you can do, Selena, is to gather all of your medical records from any treatments that you've done thus far, and have those available even before the consultation. If you can upload those items to your patient portal, the provider can take a few minutes before your consultation to look through those things and educate themselves on what you've done thus far, so that they can kind of narrow down what we may need to do moving forward. And so gathering your medical records is great. And then just having a couple of questions with regards to your specific situation. Jot them down. I find personally that I often clam up when I'm in front of a doctor, or on a Skype conversation with a doctor, and they say, "Do you have any questions?" And I sort of clam up, and that's pretty normal. But if you can write down a couple of key questions that you have, that can be a really important step. And then another thing that might be helpful to prepare, Selena, is just to prepare a time or to set up a consultation time that your partner can be involved in too, because your partner is going to have lots of questions about the process, and this is a journey that you two are going on together, and so making sure that he or she is there to support you, to ask questions, to maybe chime in on things that maybe you've forgotten. Those can all be really helpful. Those can be really helpful for your consultation. So I hope that's helping. I hope that helps. Nefertiti, do I recommend eliminating caffeine? Not necessarily eliminating caffeine. 1 to 2 cups of coffee or caffeinated beverage a day is completely fine, but definitely looking at lowering your caffeine levels. I find that many of us do consume too much caffeine on a regular basis. And so just looking at just taking inventory of the amount of caffeine that you do consume, and making sure that that is really only equivalent to 1 to 2 cups of a caffeinated beverage a day can be really helpful. If considering IVF, is the COVID vaccine a good idea? Absolutely. We got to take care of ourselves first and foremost. And so we are highly recommending that everyone who has the opportunity to get the COVID vaccine does. If you have any specific questions about your situation or anything specific, you can definitely reach out through the patient portal. We can answer, like I said, more specific to your situation. Let's see here. I'm just trying to find another question here. I have to contact the travel team to begin preparing for FET. Is endometrium safer than prometrium or vice versa? No. Neither one of those medications is safer than the other. They're just two different medications that essentially do the same thing. And so it would be similar to if you had ibuprofen and Advil. They both have the same effect, just called something different. And so that's essentially how endometrium and prometrium are. I recommend endometrium if you can get it. It is a lot more expensive, but it is a very effective form of progesterone. Prometrium also is, again, neither one is safer than the other. So whichever one you're able to get an affordable price. We have, like I said, endometrium is a little bit stronger. And so we have endometrium is 100 milligrams that's taken vaginally twice a day. Prometrium, we just bumped that up to 200 milligrams twice a day, just to make sure you're getting that full effect of the progesterone support. So that's a great question. Thank you so much for that. All right. Does the Georgia clinic do ERA? Wendy. Yes, indeed. You can have an ERA performed in our Georgia office. If for those of you who are unfamiliar, an ERA is it's a test that's essentially done during a mock transfer cycle. So we would prepare your body as if we were going to do a transfer. And then at that specific date and time that you would do the transfer, we would actually extract a sample of the tissue from the inside of the uterus, from the endometrium, and have that sample analyzed to see if that time and date that we were going to do the transfer, if that in fact is a window in which your body is receptive to progesterone. And so yes, that test can be done in the Georgia office. You can still do all of your monitoring locally and then just travel to our Atlanta office for the endometrial biopsy itself. Great question, Crystal. When should I order the donor sperm? Does it take long to get there to the clinic? No, it does not take long. Most of the sperm banks, if you contacted them today, could have your sperm here to us by mid to end of week. The two most important things with donor sperm are A, making sure that you have it here in the office, in the lab that you intend to have your retrieval or your IUI or whichever procedure you're having your oocyte thaw, making sure that it's here in the lab prior to you starting your period. We do not want to end up in a situation where you are ready for your procedure and that sperm is not available. And so while they can typically get it quickly, the more prepared you can be in the beginning, the better. And then the second thing is that almost every sperm bank that we work with, you do have to choose a sperm bank that is New York State licensed. So if you're considering a bank and you're not sure if they're approved through New York State, definitely check in with us through the patient portal so we can make sure that is an acceptable sperm bank. But they will most likely they'll send you a form that you'll then submit to us to fill out and complete, which is essentially our physician order for that said sperm. And so definitely getting our hands on that order form so that you can get it to us in time and allow a turnaround time. Nothing more frustrating than trying to get that form in and get sperm shipped in a short period of time. So take that stressor out of it. Determine now the bank you're using, the donor you're using, find out their process, make sure you get your hands on that order form, and then make sure that sperm gets sent to the office, prior to the time that your cycle is going to start. Shell, did you do a workup with your OBGYN before you started before IVF? I'm guessing you're asking, should you? Definitely everybody should have established an OBGYN locally to you. And so a lot of the preconception testing that we recommend, you can actually do with your local OB. So if you are due for an annual exam, if you haven't seen your OBGYN lately, it's definitely a good idea to see them, let them know what you're doing, that you're going to be working with an out-of-state clinic to go through a IVF or IUI, whatever the case may be, and get their buy-in, get their support, and then work with them to see what testing they may want you to do. Again, I mentioned this earlier, and I definitely can empathize with the need to go as fast as you can, because we're all running out of time. But we also want to make sure we do things right. And the last thing that we want to do is have a wonderfully successful transfer cycle, and then you start spotting or bleeding and you have no local OB to go to who can reassure you through an ultrasound or an exam that everything is in fact fine. And so definitely do a workup with your OBGYN if you can prior to starting the process, just to make sure that everything is in line and that you are good to go. Is a COVID test required for FET? How soon after an FET can I fly? So COVID testing currently not required by CNY Fertility for clients not going under anesthesia. But my recommendation is always to check with your state and local health officials, both in your state and New York, just to make sure that you're aware of any guidelines that they might have that may be outside of CNY Fertility, just to make sure that you are following all of those guidelines. And then how soon after an FET can you fly? You can really fly the next day. I do not recommend flying home the day of your transfer. And the reason why is that I've traveled a lot of places near and far, and I can't remember an absolutely stress-free flight. There's usually something in the process, going through the airport, and many number of things that's going to be stressful. And so I don't highly recommend doing that the day of the transfer. I recommend, if you can, to stay the night, relax the rest of the day of your transfer, and then fly home the next day. Question from Sherry: what should I do? I had a failed IVF. Now to find out I have endometriosis. What should I do before the next cycle? Well, Sherry, if you haven't already, I very much encourage you to set up a follow-up talk with one of our providers so we can discuss in depth your specific situation. But in general, for those with endometriosis, endometriosis is very much synonymous with inflammation. And you all probably will get tired of hearing me talk about inflammation, but endometriosis is responsible for adding a lot of inflammation to our body. And so we know, not only through clinical research, but also through our practice, that getting rid of endometriosis and endometriosis tissue can make a huge difference in outcomes for IVF and FET. And so most often recommended is laparoscopy and hysteroscopy. Laparoscopy is simply taking some surgical tools, taking a look inside the abdomen to look around and see if there is in fact endometriosis on the outside of the uterus, the ovaries, the tubes, the bowel, different areas of the pelvis. And then also hysteroscopy, which is where we're going to take a look inside the uterus to see what involvement might be there. And so in addition to laparoscopy, hysteroscopy, which can then result in removal of endometriosis tissue, oftentimes our providers will place clients who have endometriosis on a protocol to suppress any endometriosis that may exist prior to a stimulation or a transfer cycle. So Sherry, again, please give us a call. Let's get a follow-up talk scheduled. But if it hasn't been mentioned or discussed, hysteroscopy, laparoscopy, and then potentially endometriosis suppression medications prior to an IVF cycle to put that at bay, so that as soon as we get you pregnant, that endometriosis isn't going to play the type of role it would prior. If using donor eggs, Andrea, if using donor eggs, will they be fertilized before they are frozen? And do we wait to fertilize them when we are ready to transfer? Andrea, your question is probably best answered by our donor team, but I'll do the best I can. We do have two different types of donor cycles. One you can elect for would be fresh eggs, and another would be banked frozen eggs. And so when they're inseminated is determined based on whether they're fresh or frozen. So if you're going through a fresh donor cycle, then your partner or your donor would supply a sample the day of the donor's retrieval, and or your partner can have a sample frozen at the clinic for use that day, or if you're using donor sperm, then that would need to be on site the day of that donor's retrieval. Versus banked eggs they offer a little bit more flexibility in terms of once you've purchased those eggs and those are in your name, then the ball's kind of in your court. And those are not thawed and inseminated until your body is ready to go. And so what we do for frozen egg cycles is we actually start, as long as you have the eggs, we know what we're doing for the sperm, those then you would start the process just as if you're going to do a transfer. We would prepare your body, and then just when your body is ready, we would schedule the egg thaw and the insemination. And again, whether that would be thawing your partner or a donor or your partner coming and leaving a fresh sample, we would inseminate those eggs, and then you would transfer them into your body 3 to 5 days later, depending on your unique situation. And so there are 2 different types of donor cycles. Obviously, if you need to know more, please don't hesitate to send a message through the patient portal or give our donor team a call, as they're really the experts in that area and would be able to weigh in more. Are you able to donate any unused eggs? There we go. Assuming quality is good and no complications. That's a great question, Michaela. And I do believe that we have a process whereby you can donate a portion of your eggs and keep a portion. I would direct you once again to the donor team so that you can get the specifics on that. But I do believe that we have that ability. So, Shell, how long should you prime with metformin? That's really up to your unique situation. I would say a minimum of a month if you can, but that would be up to your unique situation. In terms of how long would be ideal, but absolutely possible. Nicole, my husband has 0% morphology. Count and motility are both great. How much could this affect our IVF cycle? That's a great question. So the good news is that we can typically overcome morphology or shape issues with something called ICSI, or intracytoplasmic sperm injection, which is just a fancy way of our lab technicians take the sperm, the individual sperm, and inject it into an individual egg. And oftentimes, misshapen sperm are unable to penetrate the egg. Whereas by doing that ICSI technique, or injecting the sperm directly into the egg, that bypasses that concern. And so as long as there are sperm, really it shouldn't heavily affect your outcome. So I hope that's helpful. Hi, Kimberly. All right, another question from Sienna. I know CNY is very much holistic and natural remedies, but appointments give me anxiety. Is it okay to ask for a low dose anxiety med for these appointments? Absolutely. You are not alone, Sienna. I am right there with you. Even being a fertility nurse going through this process, my anxiety during retrieval and transfer was completely through the roof. And so that is absolutely acceptable to request something for anxiety prior to your transfer. And so depending on the office that you come to, just check ahead of time. But usually the process is, once you check in, if you're wanting something for anxiety, you definitely need somebody who can drive you home and who can accept instructions on your behalf. But usually, once you check in, if you request that medication, we would be able to provide it, barring any contraindications or things like that. But that is so completely normal. And so don't give yourself grief over that. Definitely, if you need something for anxiety, ask. Okay, I had 2 failed transfers in December and doing my second egg retrieval next week. Would it be recommended to do ERA? It would definitely depend on your unique situation, but ERA can be an extremely helpful test in situations where we have multiple failed transfers. I mean, as we talked about before, that ERA test, its sole job is to determine if that time we were planning on putting your embryo back, which is usually about 120 hours for a blast, a day 5, day 6, day 7 embryo, 120 hours is the recommended time. But oftentimes we find through ERA that you might need less than that, or you might need more than that. So we have people whose ERAs come back that they need 140 hours, and that 20 hours makes a huge difference. And so again, kind of depending on your unique situation, ERA definitely might be an option to help at least determine that either, yes, we are putting embryos back at the right time, which some people see that an ERA that comes back what we call receptive, or that yes, 120 hours is correct. Some people see that as wasteful, but I don't, because that helps to narrow the window down if we are continuing to be unsuccessful. It helps to narrow the window down and help to guide us in what direction we might need to go next in order to have your transfer be a success. So ERA, highly recommended for multiple failed transfers for sure. Let's see. We have time for one or two more questions. Amy, just finishing stimulation, retrievals tomorrow. Yay! That's so exciting. I'm finding I'm having issues with the injections and needles. Can I just do vaginal suppositories instead of the progesterone injections? Amy, the answer is yes, you can. We have plenty of our clients are very needle phobic. So what I will say is that while progesterone in oil is kind of the gold standard for progesterone delivery, because it's delivered very slowly in the muscle, there are options for people who cannot overcome their fear of progesterone in oil. And those can involve higher doses of the vaginal progesterone, oral progesterone, or better yet, those people who we know really just can't get past the progesterone and oil. We can talk about doing what's called a natural transfer, which is where we use your body to produce an egg during the transfer cycle. We trigger that egg to ovulate, but what our goal is to use that shell from which the egg ovulated. We're trying to use that shell called the corpus luteum to support the pregnancy with progesterone and estrogen. So in a medicated FET cycle, your body is not helping at all. There's no estrogen or progesterone necessarily coming from inside the body. It's all coming from the oral or vaginal estrogen you take, and then subsequently that progesterone that you either inject or insert vaginally. And so a natural cycle helps to create a little progesterone and estrogen factory right inside your body that can help support that pregnancy without the use of progesterone and oil. So Amy, give us a call. Let's talk about the possibility of other options for you. Well, you'll be here tomorrow, so definitely ask at the office about the potential of doing a natural transfer. But let's see how your retrieval goes and take it from there. I wish you the very best of luck. Hopefully you're snug and tight in your hotel room and ready for tomorrow. Okay, let's take one final question, and then I'm going to call it a night. Crystal Michelle, this is a great question and a really, really common question that we get. And that question is can I put in 2 embryos? And we try here at CNY Fertility, we try to follow we do follow the American Society for Reproductive Medicine, or ASRM. They have a set of guidelines for the number of embryos to transfer. And the guidelines are based primarily on age of the client, so your age, and then the age of the embryos, meaning are they day 3 embryos or are they blast embryos? And so these guidelines were developed with lots of research, lots of clinical outcomes, and are put in place with the goal of keeping you safe. We know that twins and higher order multiples like triplets and quadruplets are extremely risky and dangerous. And so our goal is always to get you pregnant with one healthy baby. And so while yes, there are circumstances where we would permit you to put in 2 embryos, those recommendations are going to be based on, again, your age of the embryos, and then your unique situation. So clients who maybe are younger, who maybe don't fit the guidelines, the ASRM guidelines to transfer to, but have had multiple failed cycles, those are going to be, that would be the type of situation where we might say, let's put in 2, let's give this another try. However, I think it's important to note that transferring 2 embryos does not double your chances. So there is definitely a misconception that 1 embryo good, 2 embryos double the chances, and that's not necessarily the case. And so because we know that there's a good chance both could stick, we want to make sure that we sort of mitigate that risk and keep you safe. And so it's always a case-by-case basis. So I would say yes, you could, but definitely have a chat with a provider and see if that might be a safe option for you currently. So thank you all so much for spending some time with me this evening. I apologize if I wasn't able to answer everybody's questions. I did mention in the beginning that this is kind of a new setup in terms of the questions and the way things come up. So I know that I did miss a lot of questions. I think I answered a couple people's, the same person's questions a couple times. So forgive me. But I hope everybody learned something. I hope that you might take away a thing or two from this talk about self-care techniques, mindfulness, breathing, diet, nutrition, therapy, different options in order to keep yourself healthy in the process. You don't want to give up on taking good care of yourself during this process. And so hopefully you've learned something that you can put into practice that will help you in your journey. Again, I will try to go back a little later and answer any questions that I might have missed, but I hope everybody has a great night. And then next week, we're going to talk about fertility cycles and how we can better include our partners. And so I hope you guys will tune in next week to that topic where we'll talk about making sure we keep our partners integrated into the process. And then definitely tune in later this week for talks from other providers here at CNY Fertility so that you can continue on your journey. I appreciate all of your time. I hope you learned something, and we will see you soon.